Okay, we'll go ahead and get started. Thank you all so much for being with us today. I'd like to welcome you all to the Southwest Center for Pediatric Environmental Health's Grand Round series on pediatric environmental health. Today we have Dr. Rebecca Campos with us. She's going to be speaking on pediatric herbs and supplements in the ER. But before we go on, I'd like to just briefly share about the Southwest Center for Pediatric Environmental Health. We are one of 10 PACUs, which are Pediatric Environmental Health Specialty Units in the United States. And the purpose of the PACU is to serve as a national source of medical information on environmental conditions. Each of the 10 PACUs are hosted by a medical university, in this case, Texas Tech Health Sciences Center, El Paso, and covers a region in the US. And our region specifically is includes Texas, Arkansas, Louisiana, Oklahoma, and New Mexico. So we have quite a large region. To serve our mission, we offer a Grand Round series once a month on the third Thursday of the month at 11 a.m. Mountain Time. And today, as I mentioned, we have Dr. Rebecca Campos with us. I would like to also let you all know just a few housekeeping items. You all will be muted and you will not be able to share your screen. But if you have any comments or questions, please add them in the chat. And at the end of Dr. Campos's presentation, we will refer back to them. I'll also say that in the chat, I will be adding information such as my email, CME and CNE information, how to access your credits, and different odds and ends as they come up throughout the session. So please go ahead and open your chat function so you can be aware of those. I would like to acknowledge our funders. The PACUs are funded through ATSDR, Agency for Toxic Substances and Disease Registry, and the EPA, Environmental Protection Agency. And the funding is then funneled through the American Academy of Pediatrics into each of the 10 regions. Here is the information for both CME and CNE continuing credits. Don't worry, I will put this information also in the chat. If you would like to scan the QR code here, please do so. I will also put the link, and if you are going to need to reference this talk, we are number 3705 if you're needing to contact us for any CME, CNE purposes. Our next Grand Rounds is June 20th at 11 a.m. Mountain Time. We have Dr. Stephanie Weiss, who is a medical toxicologist and emergency medicine physician. She currently works at the National Institutes of Health with the National Institute on Drug Abuse. She is going to be speaking to us about semaglutide in children and adolescents. I want to let you all know that we have 2 new training opportunities. We provide curriculums in pesticide use and its health effects along the US-Mexico border and anywhere as well within our region. And then we also have a new curriculum on childhood cancer and environmental exposures. If you all are interested in attending one of those trainings, please feel free to email me and we will make sure that we send you out the information for our next sessions. So without further ado, I would like to present Dr. Rebecca Campos. Dr. Campos is a native to El Paso. She completed her residency in family medicine and a fellowship program in integrative medicine. She provides care for full spectrum family, including pregnancy, delivery, newborn, all the way to adult care. With her fellowship in integrative medicine, she also provides adjunct therapies that help to reach patient goals. She's also trained in acupuncture, and offers that as an adjunct treatment as well. She currently practices at Texas Tech Physicians of El Paso at Trans Mountain, and she also serves as the director of the Texas Tech Health Sciences Center El Paso Paul Foster School of Medicine Medical Skills course. So we are very fortunate to have her with us today and having her present on pediatric herbs and supplements in the ER. Thank you so much, Dr. Campos. I'll pass it over to you.
Well, thank you for the invitation. This has been very helpful to look at a few areas. As you mentioned, with the integrative medicine, there is a focus on the botanical and herbal medication, but the big pull away from that is that we can't memorize all meds and all herbs and all side effects, but there are patterns that hopefully we can take a look at. Looking at our acknowledgements, I have no financial or conflicts of interest to disclose. And so for my objectives today, the first one is I'd like to work on is being able to identify common regional botanical herbal therapies that are frequently utilized by the public as home remedies and that may be present from the intentional use and incidental use. To be able to assess and obtain a proper history of supplement use, including herbal medicine from patients and caregivers of pediatric patients. To identify common symptoms and concerns that are often associated with herbal and supplement use by patients and their caregivers of the pediatric population. And to describe the potential risks of the herbal toxicity and interactions with common supplements that are utilized in our community, especially along the border and in the Southwest area. And then, of course, what's probably most important is to have a good access and understanding of the proper resources that one can use to evaluate and see what available evidence there is on certain herbs and supplements that you may come across. So first, I should apologize for my throat. Allergies are really kicking in, so I do sound a little different. If you can't hear me, please let me know and I can readily repeat anything. As far as complementary therapies and what you may encounter, both outpatient and inpatient, there's going to be beyond the nutritional, so special diets, physical, psychological, all of these are different holistic components of the complementary therapies that patients in general will approach. And they all come with this other. So if we break it down, so there'll be a nutritional component where we have food, diets, prebiotics, probiotics, and then of course the supplements, dietary herbs that we'll focus on today. But your patients may be involved in a few other areas. And at the very bottom, you'll see here that the culture and the other can include some things that patients may be using and seeking other practitioner care. So Ayurveda medicine from India, for example, incorporates different components of care from certain supplements, certain herbs, dietary and actions, traditional Chinese medicines. There's included Tai Chi and so forth. All of these are going to be areas that hopefully we can later probe into, but today we'll just focus on what we call DHS, dietary supplements and herbs and supplements. When it comes to botanical medicine, sometimes it can be difficult to define a few things. There are a lot of terms and wording that are very interchangeable. Overall, botanical medicine is the study of the plant or plant parts that elicit some sort of medicinal or therapeutic properties. And for that particular reason, people will try to concentrate them or just use them in different modalities of delivery. But within that subset, you'll have a range of products and commercial products as well. And you'll come across different words like phytomedicines, phytotherapy, herbal remedies, herbal medicines. Their forms can be in a huge range of presentations: capsules, teas, tinctures. Those tend to be your oral ingestible forms. Creams and gels will be your topical forms. And then we have the term dietary supplement. Dietary supplement tends to be the big umbrella term for vitamins, minerals, herbs, and other botanicals. However, but dietary supplement infers that it is intended to be used by ingestion. And we do have our Dietary Supplement Health Act that helps to protect and emphasize good practices in establishing our herbs. So when it comes to the emergency department, there are a few things that we have to keep in mind, and some of this applies outpatient. This study that actually recently came out reflects over a 3-year period from 2017 to 2020. And what's most concerning out of the entire article for me was that many individuals, both adult and child, had reported multiple uses of different dietary supplements. So if you look here from the children pediatric window of 0 to 19 years, about 7% were using at least 2 or more. And if you look at the adults, we're looking at well over 30% that use 2 or more, even 4 or more supplements. And what's of note is that these will often be used in combination together with multiple herbs, but also in combination with over-the-counter or prescription medications, which opens a whole other area of concern. And as we all can relate in practice, in different environments of practice as well, is that there tends to be an underreported use of herbal supplements for multiple reasons. But what we would take away from here is that in our adult population, more than half have used some sort of dietary supplement within the last 30 days. And in this older study from 2002, 1 in 6 individuals combined the use of their prescription medications with at least 1 or more herbal medication. And many did not try to pursue any sort of counsel about how to use it or safe use of it. Now, when it comes to documenting the herbal use in pediatrics, there's a wide range. So to show the extremes of that, if we look at this one study from 2005, the reported use was quoted to be anywhere from 1 to 77%, which essentially means we really have no idea. We just know they use it a lot. But in the most recent 2 years, a lot more has been underway in understanding and looking at that because of the growth and because of the attention in herbal and other alternative treatments that the population pursue. We can see that 20 to 30% of the pediatric population have used at least one complementary and alternative medicine in a clinical way. And in a study that just came out last year, a 3-year interval was looked at. We saw the chart from earlier, and we saw that 35% was in the past 30 days in any form of dietary supplement may have been used. What are common presentations of herbal toxicity in the emergency department? Well, many times patients in the family may be pursuing advice or counsel on patients who had an unintentional or unsupervised ingestion of some sort of herb or supplement. And the vast majority, over 80%, will actually be asymptomatic. But the others can be very mild to very severe presentation. And this list can actually reflect what can both be seen in pediatrics as well as adults. So one common one that gets overlooked is just a simple allergic reaction. So what may be the presentation of eating something that a person may be allergic to, from mild hives, skin rash, to allergy type symptoms with congestion, to full-blown anaphylaxis, are things that can be shown. And ideally in that acute type of presentation, it's going to be easier to identify the culprit, but in many times it may not. Some people will overlook things. I've had patients with a history of allergies and will like to take their herbal tea, and we make the connection that, well, if you have an allergy to ragweed, that opens up a lot of herbal teas that you could be vulnerable in making other symptoms or symptoms worse. The other ones of concern can be hepatotoxicity, including nephrotoxicity, but there's been more emphasis and recognition of elevated liver function studies in hepatotoxicity, which has coined a few terms that we now see as HILI, herb-induced liver injury, similar to what we're used to with prescription medications, DILI for drug-induced. We'll go over that a little bit more in a little while. Some medications and herbs can be used and for different reasons, and the other side effect of hypertension and tachycardia manifest. One common reason is weight loss medication, and so there we'll see herbs that have been adulterated is the term that we use, and contaminated by use of other medications even to try to elicit what we want to get out of the medicine. So the example would be weight loss medication, ephedra, sometimes added with a lot of caffeine. One anecdotal case is a patient who came in with no history of high blood pressure and comes in with headaches and hypertension. And looking at this weight loss regimen of teas and capsules and other powders for smoothies, this branded supplement that they were using, fortunately, where they were able to bring it to me at a follow-up visit, and we saw that they were ingesting well over 3 grams of caffeine per day. And so it wasn't necessarily the herb that was the culprit, but the added things that were given to do that. So many will have additional caffeine to it, but other herbs that have caffeine, like ephedra, would be ones to be on your radar. Electrolyte imbalances can be some issues, especially if there is diarrhea side effects. But in another case, hypokalemia could be a result of an herb like licorice, which may actually produce some aldosterone-like effects and can produce hypokalemia as a side effect. So some of those would be really important to have some familiarity. Typically, the candy licorice is flavored but doesn't have the glyceride component that causes the aldosterone effects. Bruising and hemorrhage is something that we can see much more often from the herb perspective. Your ginkgo can have an effect on that. And from a supplement, omega-3s can also affect platelet function. So even if somebody isn't having overt bruising or bleeding, it is good to counsel our patients that if they have some sort of surgery, cataract surgery or other major minor surgery, they should be stopping these supplements. And for safety reasons, I will probably overcompensate by taking at least a week in advance. Reflux is another one that can be a side effect that we see regularly for many people that take peppermint for other symptoms like IBS. But peppermint has been shown to relax the lower esophageal sphincter and cause reflux tendencies for patients. Some others that we're seeing in 2015, an article came out, and this was a very nice, almost 10 years review of 63 emergency departments throughout the United States. And while most of them were adults, there was a component of unsupervised children that were surveyed in this study. And the presentation wasn't necessarily the important for me, but the actual culprits that were involved tended to be most often the multivitamins that patients and children were ingesting. And with the children, it was unsupervised ingestion. And I suspect that's mostly because of gummy vitamins that were thought to be as candy. Iron was another one, and then as expected, weight loss supplements and sleep, sedation, and anxiolytics, which I suspect from 2015 to now, the anxiolytic and relaxing supplements will have gone up by a lot given our COVID and home situations for that. What we need to remember for some of these is the pediatric vulnerability, just like we look at our prescription medications, the same applies. But one thing to consider is that having just finished our flu and cold season and some that lingered, we see how difficult it is for parents to deal with patients and their kids under 2 years of age when most of the cough syrups and other medications over the counter are just not suited and recommended for less than 2 years of age. And that leads a lot of caregivers to pursue other modalities to try to give some relief to their children. But we do need to keep in mind that the pediatric metabolism, their digestive system, their immunity, they're not fully developed, so they're definitely more vulnerable. And even though superficially a very general statement is, yes, medicinal plants tend to have some less overall side effects than chemical drugs, it doesn't mean that they're safe for all direct human use. And when it looks at pediatrics, the younger they are, especially your neonates, they have a lot of unrecognized and not aware of the symptoms that they may actually show sooner than the adult. And at the end of the day, we know that while mortality from medicinal plants is quite low, we really don't have the studies that we do with our other prescription and medication to provide us with the toxicology information or antidote information when we have these. Most of the time is supervision, monitoring, supportive care, and trending. So this study was a meta-analysis of 127 studies. And I highlighted a few that we tend to see more common. Green tea is something that may be drinks that children will have, and liver failure was concerned. But what it did point out was it's the high volume and frequent regular use that was the main factor in liver failure here. And as with other ones like black cohosh, for example, that tends to be used for menopausal symptoms in women and vasomotor, there was also a concern for liver failure. However, the cases, as further investigation shows, many times it's because of a contaminant or super therapeutic dosing that patients take upon themselves. Belladonna is another one that's important for me to highlight because, especially thinking of the pediatrics, think of their age group as well as what they're going through. And that would be teething, for example. In teething, you would need to make sure to specifically ask if they're using any teething pellets, because one common component is the belladonna in those homeopathic treatments. And that has been known to provide and lead to anticholinergic symptoms. So the sedation, the sleep, is it because it's relief or is it because they're having side effects from the treatment? So that needs to be on our radar. When we were short of therapeutic options for cold and flu symptoms with cold, flu, and COVID, eucalyptus seemed to be very helpful. But a few drops in the shower is different from ingestion and topical direct application. And that can be a concern, especially in pediatrics, because of the absorption and the fat distribution in children and toddlers. That absorption is increased and you would have more CNS toxicity potential. So for time's sake, to not spend on liver and kidney injury, we'll focus on the liver, the drug-induced and herb-induced liver injury. And if you look at the studies, overall, there is a higher incidence of injury through prescription medications than there is through herbal-induced liver incidence of liver injury. But there's two things to consider. There's a high suspicion that the true incidence as a result of herbal use is not fully reported accurately. But we do see that, unfortunately, there is some growth on that. In this recent study from 2023, we do have a drug-induced liver network. And this multi-center collaboration actually found cases have, unfortunately, more than doubled. So from 7% to almost triple 20%, we see an increase in herbs and dietary supplements that were attributed to some liver injury. However, there is some good news. In the early 2000s, there were some more child safety campaign efforts that were being implemented. And that included the packaging, the labeling, education to family, and all of those did show some promising benefits from the presentation of toxicity and emergency room exposures. Here's an example. We're comparing two windows of time from 2009 to 12 and 17 to 20. And look at the number of prescription opioids that we can see here. We went from an N of 4,800 to an N of 2,200 estimated in that window of time. Same thing with benzos and muscle relaxants, a successful decrease, although there's definitely room to improve. Unfortunately, when it came to herbal and alternative remedies, we saw the opposite. We actually saw an increase of 1,500 to more than 2,500, almost 2,600. And these are concerning numbers and something to keep in mind in terms of what is the packaging like on some of our herbal treatments, and the focus of that, because we do tend to oversee them as overly benign when they're not, they aren't always are. And another one to emphasize is our liquid medications like acetaminophen and other cold products. Look at the improvement in the number of ER visits from that. So when we look at these unsupervised exposures and we talk about the toxicity, we should also consider the interactions. So on one, as we mentioned, toxicity can be acute, sudden onset. One example we can talk about will be cannabis a little later. But then there's also where symptoms may not always manifest early on, and it takes recurrent buildup use or prolonged use of a certain herb or supplement to then manifest certain symptoms. When it comes to interactions, we do need to be aware of not just the adverse effects of the herb, but on the medications, but maybe augmenting some side effects of medications, namely like chemotherapy. So we do need to keep in mind the patient population, the vulnerability of our pediatric, the dosing differences that may need for certain herbs and supplements, but also our chronic conditions like failure patients who may not be able to renally clear a lot of our supplements that also need to be cleared renally. The elderly, well, there could be more medications, more risk of polypharmacy and interactions, but also immune suppressants. So looking at certain metabolic processes of how we break down our herbs can also impact the buildup or run through of some of our medications like immune suppressants. Um, this is a little bit of an older study, but it actually pointed out some really key information that I would like to emphasize. This study came out in 2003, but it reflected on a 3-month period in '01 in Atlanta region, and there was a pretty decent number of surveys, 142. While there were multiple herbs that were used, I did list the most common ones. Aloe was 44 and echinacea 33, eucalyptus and others were less than 20% use. Um, what was more striking about this study was the caregiver knowledge. And I think that is important for us to keep in mind when we take our history and educate the patients is there's side effects for these as much as there are for prescription. And here we saw that 77% of those that were surveyed, caregivers and parents, did not believe or were uncertain if herbal products had any side effects. And for the few, only 20% could name a potential side effect. But about 2/3 were unsure that herbal products didn't have any interactions with other medications. So what was of concern here is that there was a belief that it's just overall more safe all the time to use herbal supplements instead of traditional Western medication. But while all of these products, or many of them, are considered benign, several cases were identified where there can be detrimental effects to the recipient that we saw here. There was even death in two children, which were very young children. But what the concerning part is that in this population of caregivers, many of them didn't believe that the products had any side effects or any potential. So it's not even on the radar for consideration. It's very complete trust in their safety. So one thing that's important is that what's really key, we cannot memorize all the herbs and all their key presentations, and their presentations can overlap. But what will be helpful is finding out what your patient is here for and what they're taking it for. So if your patient is coming in for colds, whether it's children and including adults, that tend to be the most common reason is cold URI symptoms. Those are the ones that most likely were concurrently taking some sort of herbal remedy. But the other causes specifically to pediatrics were burns and cuts, help to boost the immune system activity, and for relaxation, and to me, probably some sleep component. And these were the most common ones, specifically presenting into a pediatric ER. Because we're on the border area, looking at some of the Hispanic pediatric population, there is very little data. There's very little data altogether, just in the pediatric population, much less in the subcategory. But in one area that we did take a look at, there was one article that was decent in 2005, a very good article that reported that many didn't actually report it because it didn't occur to them, not necessarily because they were specifically trying to avoid it. So I think we've all heard the importance about asking them for any over-the-counter, medication, herbs, supplements, vitamins, et cetera, et cetera. We all have that little spiel a lot. But what was also important was that of the good number, over 600 surveys, more than half of them did use dietary supplements and an herb. And the most common ones were these. So I highlighted the ones that we do tend to see most often. I was able to ask some of our pediatric faculty here to recall what they see in their clinics often. And the responses that I got were commonly aloe, chamomile, ginger, peppermint. And so this article, the same article, provided some good information about what were the uses so that it's on our radar to make sure to add a little extra emphasis on our questioning, but the potential interactions with other medications and their adverse reactions. And what I did like about this study is, if you see here, the um, enzymes used for the metabolic breakdown, like of chamomile here, the CYP3A4, is helpful. We're not going to find studies that test chamomile for other interactions, but at least if we know it's metabolic, we can keep that on our radar for the prescription medications that we know that they do take. Ginger is another common one here. If we have time, I'd like to go over that one because it is a frequent one used in our pregnant patients, and that in turn can affect our pediatric patients as well. Very common is peppermint. So here at our medical school, we have a front courtyard, and there's a big area of this yerba buena, and it's a very common herb here in the area that used for a lot of dyspepsia, heartburn, reflux kind of symptoms, and many patients report relief and improvement with it. But keep in mind the interactions with the CYP450, histamine. So intermittent use is one thing, but frequent, regular, high dose use is something to definitely be careful of. But as you see, the type of plant that it is, allergic reactions and irritation are something that we can consider. So just looking at a couple of the common herbs that we will see in pediatrics, at least along the border, we'll look at aloe and we'll look at the German chamomile, what we call savila and manzanilla here. What would be helpful to gauge is many families and patients come in using these, and then you have to ask them, well, how do you use it? How do you prepare it? And who told you? And I recently did a small pilot with surveys with the medical student here, and we were able to get similar data like this shows here from these other articles, where most recommendations were by family, and that was the same that we saw. So hopefully we'll expand to do more of a study with this, but other studies did show that recommendations came also from friends, but the most motivating factors were to avoid the side effects or to find some sort of treatment that would work when others did not. The last one, avoiding doctor's appointment, I wasn't keen on the terminology there that was used in the article because many times it's not necessarily to avoid a doctor's appointment, but also because there's decreased access to physician appointments. So many times they may use an herb until they're able to get seen. And that even speaks from my own experience growing up here on the border. But here's a small reflection of what we were able to get from our survey from patients here in the El Paso area. And so for the number that we were able to obtain, the most common ones that we saw used were the yerba buena, spearmint or peppermint, and manzanilla chamomile. But there were a few others that are a little more unique to this region. But there are some guided information. This comes from an article in Contemporary Pediatrics that shows that based on some studies, there are references provided that some of these can be used at safe doses and short intervals of time. German chamomile has been used and has had studies showing its benefit in very small doses for colic in small children. Now, it may not be something I would recommend because I think the formulation and preparation is really important. But some of these others, if you notice, do come in tablet forms and other forms for taking, which to me is difficult because it's also in an age group of 4 to 12 where many cannot take tablets. But at least this does the purpose of what I was hoping to show, is that there are some studies showing some safe use of herbs. Coming back to aloe, there is in vitro and clinical evidence showing the anti-inflammatory, antibacterial, fungal benefits. Wound healing tends to be the most emphasis. It is typically used topically, and that has been used for reducing and showing a benefit of reduced acne lesions as well as healing. We tend to think of sunburn, but even some partial thickness burns. And one key factor of mechanism of action is that it inhibits the synthesis of thromboxane A2, which is a vasoconstrictor. So with that action, that would hopefully help provide some more perfusion benefits to the wound. And one small study there was a meta-analysis of 4 clinical trials and looking at second-degree burns. And in that, it did show almost a 4.5 day reduction in healing time when using aloe compared to control. And those controls were silverdene, sulfur, silver sulfidine, and some gauze treatment with the chlorhexidine acetate. So this is a bit, encouraging that this can be used potentially not instead of, but together and a BID dosing and have some more healing benefit. But there is an oral use of aloe here, and you'll see that frequently in um, uh, grocery stores, at the market, and at some of the pharmacies here in town, where you will see a certain section of home remedies, and you'll see savila, and that is the Spanish name for it here. And many will use this orally, most commonly for constipation. Although if you read about it, there has been other uses and evidence for some improvement in your A1C and lipids. But for that prolonged use to have those benefits, I would discourage it. But intermittent PRN has been used for constipation with some success. But it's important to know, I guess you could say, the anatomy of the aloe leaf. So of the aloe gel and the aloe latex, we compose a whole leaf. The aloe gel overall is safe when used short courses and orally. There's some studies that show dosing for up to a month with no issues. The aloe latex and the whole leaf, those are the ones that have the problem. These are the ones that are considered unsafe. The latex is the more yellowy component within the leaf if you're able to cut that apart. And the whole leaf extracts that you may find as well in supplement bottles there at stores are the ones that we need to avoid. In fact, they should no longer be on the shelves anymore. They have the latex component has been found to have glycosides and anthraquinones, which are concerning for carcinogenic activity. So in about 2002, the FDA banned and removed the supplements that included that aloe latex due to those carcinogenic concerns. So it is important to keep that on your radar because they shouldn't be on the shelves. But again, it is important to emphasize because we are on the border, many patients do cross to get medications, prescription medications, and herbs, and this may be something that we can keep on our radar as we go through our patient supplements when we do med reconciliations too. Aloe has been part of a little bit more in studies, so there's more direction on interactions of medications to be cautious with. So any anticoagulants and diabetic medications can be augmenting their risks of the bleeding and hypoglycemia. The biggest medication to avoid is the interaction with digoxin. And of course, as far as a diuretic, because of the constipation, laxative, electrolyte losses is another side effect, just like we mentioned, hypokalemia from like licorice. This one's a different mechanism there. The other one is chamomile. So chamomile, it's my little mouse. So chamomile has been very useful and has actually some growing studies and use for like colic and other pediatric uses. In general, GI and some skin can be used. You'll hear of people using tea bags to different skin areas, including eyelids, minor infections. But originally, good to know from the historical presence, it's been seen in like Egyptian and Old Greek documenting that this has been used medicinal purposes. But currently, while we use it a lot, it actually originated more from German. There are two, German and Roman chamomile. German is the one that we're most familiar with and use. And that's what patients, when you hear in clinic using manzanilla, that's the German chamomile that they're using. And it is typically used oral, but although, like I mentioned earlier, can be used topically for certain skin conditions. But orally, the sleep and relaxation benefit has been helped as part of their routine. I have patients, probably a little small 1 cup routine to help relax them. Dyspepsia and upset stomach, a lot of patients might have grown to like it around the holiday, Thanksgiving, and the overeating. A little cup of chamomile tea kind of helps settle the stomach a little bit. But in terms of the infant colic, though, they're very small, very few studies that are available. But there are a few randomized controlled trials that do show patient numbers or study numbers of up to the 60s to up to 70 patients. And these are children that have been given usually a combination to emphasize from earlier slides, not just chamomile alone, but usually a combination of chamomile with fennel and lemon balm that we know is like Melissa officinalis. Some of those will be given into a small little liquid formulation, and little doses were given to children over a course of 2 to 8 weeks with colic. And that study, one in particular, showed that over half, 57%, actually did show some resolution of colic, while others showed some improvement. There was one more study that had up to 93 infants, and that combination formula had chamomile, fennel, lemon balm versus placebo, and they were dosed twice a day as opposed to 3 times a day on the previous study. And after 1 week, 85% had some decrease of their crying spells. Not complete elimination, but decrease. And as a parent, I think we all know that even a decrease can be significantly appreciated. And what's important to emphasize is that in either one of these studies, there were no adverse effects reported. So just remember that it is a plant. It's a weed, so to speak. And so allergic dermatitis, irritations to the skin can happen. There are oral rinses that can be used. I've never seen those or used them or recommended them, but they are reportedly in use at times and can cause some burning to the oral mucosa. But just keep in mind that one area that is not fully studied is in pregnancy. So I very clearly discourage use in pregnancy because there is unclear evidence that it may cause preterm labor. But anecdotally, I've had cases of patients that a couple where one from decades ago reported drinking this a lot, and I suspect it being the cause of preterm premature labor. And another patient that helped augment her labor as well. So just remember that if you're allergic to a lot of plants and flowers and weeds, you may also be allergic to the herbal teas that you may so want to take, or your patients will. So just of note again to emphasize that there is limited knowledge on mechanisms of actions of herbs, but there are some that may be the information that we do have to know what enzymes we are actually using for breaking them down, to try our best to use that to anticipate medication interactions. So overall, chamomile, be careful with your SSRIs and others. It may increase sedation. Contraception and estrogens, you may negatively impact your hormonal-based contraception. So that would be a concern for increased risk of pregnancy. And then, of course, high yield, high concern medications like chemotherapy, tamoxifen, warfarin, and other immune suppressant medications like cyclosporine that rely on CYP450. Patients need to definitely avoid use. All right. So then what I'd like to emphasize is the dramatic changes in 2 more supplements that we have encountered more. Cannabis has grown a lot. We can identify 2 areas. One area is when the legal status of cannabis changed in many states. So we can see that effect as a trend from this one study from 2004 to 2017. But then again, we also have some changes from the 2020 window when COVID hit. So we do see, as the legal status changed, huge changes in increased. In children less than 10, we see almost a double rate of exploratory ingestion from 1.1 to 2.3 per 100,000. And in adolescents, that's well over 4 times the amount of exposures. So there's a lot of important information, but we're going to point out just a few things here. In our younger populations only, even though the trend actually carries through, in our younger populations, we see from 2019 to 2022, look at the huge dramatic increase of cannabis-involved ER visits. So in these, we're seeing just a significant growth. What was important that they also pointed out was the second half of the school year, maybe where things are winding down, party time, I don't know, but we will see that there is a change in our increase dramatically. And a huge, most important trend is in our adolescents, 11 to 14 years. What we do need to know is if somebody comes in with a suspicion of a cannabis ingestion, regardless of the age, Their next question needs to be the modality. Many will assume inhalation, but there is a lot of growing ingestion, like the gummies and foods and so forth. But what's important to note is that if this is inhalation, your monitoring time versus your oral monitoring time for side effects or worsening conditions of your patient does vary. So if you looked at the peak serum concentration and the rapid delivery absorption is most dramatic in our inhalation and smoking. And if you look at the minimal dose here on our last column, it only takes 2 to 3 milligrams for a naive user of inhaled um, THC to manifest the psychoactive effects in others, versus oral 5 to 20 milligrams ingested, and that can delay serum peak for up to 1 to 2 hours, even up to 10 to 8. But the onset of the psychoactive effects, look at the duration of up to 4 hours in inhalation or 12 hours in oral. So quick to show and quick to burn out versus very slow to build up in oral. So those are really important for us to know that the inhalation has the most dramatic effect. When it comes to pregnancy, well, there are no studies. They're all retrospective studies of use in pregnancy and breastfeeding. But what we do see is there are associations that can be made with preterm labor and other neurologic effects that have impacted children of moms who used cannabis during pregnancy or and before, likely. What was concern for me in this article was that 11% of those that are breastfeeding, actually reported use of cannabis. And as far as the concentration that can present in breast milk, it's variable. That we don't really have any studies that show that. So definitely an important educational point for patients. Pediatric intoxication also varies with, clearly, as we saw, with the amount and with the route of administration when it comes to cannabis. But you can have predominantly our neurologic presentation here. GI hyperemesis, something like we also see in our typical hyperemesis with cannabis. And the dose ranges for any of these can range from the 2 to 3 milligrams to the 5, as we noted earlier. So just consider that when you have your afebrile patient, pediatric, coming in and they're appearing with new onset neurologic symptoms, well, even beyond the list here from the article, drowsiness, lethargic, those should be concerns for some sort of toxicology exposure. And the other thing is that as we have bred our cannabis more and more, and there's different strains, there's also much more potency in the cannabis of now than of 20 years ago. Another supplement that has exploded in use is melatonin. But what's important is that this one is not an herb, but is a supplement. It is hormone based, but they are synthetically made and sold. There are 2 versions of a melatonin receptor agonist that are prescription on the market for insomnia. But overall, the supplements are not FDA approved, but there is some regulation involved a lot with the Dietary Supplements Act. But what's important to note here is for many reasons. Number one is the growth from 2012 to 2021. Look at the range of 0.6% of all ingestions that were reported to an ER, 0.6 in 2012 versus almost 5% in 2021. But again, the vast majority were asymptomatic. It was found incidentally that they were doing this. And here we had 2 deaths, and one of the deaths was a very young child. But the biggest issue in this article for me was a 530% increase in the melatonin ingestion presentations in the ER. But the biggest growth rates that we could see per year in this article was most dramatically seen in the 2019-2020. And in this discussion, some assumptions were made because melatonin comes in gummies, so it can be more appealing to children. They see it as candy. And also because children were home. We were in isolation and stuck at home. And so parents were more aware of the energy and inability to calm kids down. So there might be more use for that. What we do see about melatonin and the toxicity is liver metabolized and there is renal clearance. So again, really important to keep in mind the comorbidities of our patients who have problems sleeping and want to take some melatonin that may be in stage renal disease or on dialysis. Ideally avoid it or just the lowest milligram dose as possible, 1 to 2 milligrams. They can come up to 3 milligram in their lower size dosing. But what is interesting is that melatonin has been shown to have some immune function of benefit to certain interleukin and T and B cells. And there are not very many drug reactions that have been reported, considering we have quite a large growth of reported interactions and ingestions. There weren't a lot of drug reactions identified. So toxicity is overall low. So in terms of safety, it is probably still one of our safer supplements. Cannabis and melatonin, however, are also being advertised and combined, and they're coming in as gummies. So there was one article that showed an independent testing of 30 of them, and the range of the melatonin and the range of the cannabis, which is completely wide range. So be careful of that. And in looking at many of these studies, one of the biggest areas of risks happen to be contamination found in supplements that were purchased on the internet versus in stores. So that's important. So to bring a lot of this together is just to reemphasize, think about your common diagnosis or symptoms, consider the reason as to what your patients are here to see, and most likely related to the reasons that most people will take some sort of herb or supplement. So URI symptoms was top in both adults and pediatrics. GI symptoms is consistently in both. Anxiolytic, relaxation, sleep, those also were in both. Keep in mind, be very prepared to provide a lot of education to the parents or caregivers because many of them are just not even considering or uncertain of the potential side effects for herbs and their interactions. It hasn't really crossed their mind. So just a little bit of a guide, just ask about different therapies, making sure to clearly ask about any other over-the-counter supplements, herbs, vitamins, minerals that they can take. Respect them. I've had a colleague who's a physician. There was a cultural tradition after delivery to put something on the baby just to make it brief. And she knew, as a physician, knew that there was no therapeutic benefit, but it was more just for tradition purposes and how the physician was very judgmental. And that really hinders the relationship so that they're not stay open to other times that they might be using these. And just remember sometimes that all you can provide is offering regular response for treatment and making sure that they're tolerating it, that their liver enzymes aren't increasing, or that they're not developing side effects that they themselves are not recognizing. So try to do your best to educate. There's so much for us to learn, but hopefully evidence-based information can be helpful. These are a few of the links for good resources. Natural Medicines in the middle here has a really good list of will give you access and listing of the articles and studies that support statements, gives an idea of dosing, contraindications, benefits, and not, and gives some handouts. So here's one example comparing that German versus the Roman chamomile and the kind of information that you can use. And then my last two recommendations. This is the National Center of Complementary and Integrative Health, which is renamed from the National Center of Complementary and Alternative Health. Or alternative medicine, sorry. So this is the new name, but as you can see, you can get free CME on different topics. If you click that health topics A through Z, you'll open here and you can get access to looking at different herbs at a glance. So very brief, very superficial information that can help you in a busy day in clinic to quickly get information that you need. And you can register here for a newsletter. And then if there is a concern and you're not sure, go ahead and still report it so that we can get more data available for the FDA on safety with herbs and how they may present. Any questions? I think I see one. Do you ever advise them to avoid bringing gummy preparations to the house when non-gummies are available, for instance? I'm going to assume that this might mean for melatonin and maybe even cannabis gummies. I tend to say just make sure that they treat it like every other prescription medication, making sure that they can have the jar that's child lock put up somewhere, not down on the counter where some child or toddler might think it's food. If they can avoid bringing it home, that would be great, but I don't think that's an option for most people. But it would be nice to have good safety packaging consistently implemented on our supplements, just as we do on our prescription and other over-the-counter medications. I hope I answered your question there. And here is the link for more on the Southwest Center of Pediatric Environmental Health.
Thank you so much, Dr. Campos. That was an excellent talk. If there are any other questions, please leave them in the chat, and we'd be happy to get those to Dr. Campos. In addition, if you have any questions about CME or CNE, I have added a QR code and a link that you can use to make sure that you have completed what you need to for credit. If you still have questions after today, feel free to contact us at the email provided.